I've got several things that I thought would be of interest to go over. You should be seeing the U.S. map on the U.S. EpiCurve on coronavirus. Things are continuing to look good across the country. New cases, new daily cases are coming down. Hospitalizations are coming down. Interesting, deaths nationwide are coming down. It's not the case in Alabama. You should now be seeing Alabama's EpiCurve. That's a really steep decline, and it's even getting steeper. So we're now down to about 2,000 cases a day. Hospitalizations are dropping off remarkably too, but deaths are still lagging in Alabama. If you look at places surrounding us, so you can see this decline in all of these counties, and then in the states surrounding us. When I show Suzanne's slides, the metric that CDC is now using is weekly COVID test per 100,000, whereas what we had been following for a long time was the daily case per 100,000. So these numbers, the sort of the tipping point historically has been around 25 in terms of when we really get concerned. And recall that Mobile County a month ago was 125, 130 per 100,000. So these numbers are different from what I will be showing with Suzanne's slides. The data for UAB this past week, 24 students, 11 faculty and staff, and 45 clinical employees. So that's 24 students last week. And so that's down from 53 the week before. And that's a 5-week downward trend, despite the fact that we actually started back on campus at this time. So that, to me is an extremely positive thing. Staff, faculty, 11 last week. And again, that's another decline from previous weeks. So a pretty steady 3 to 4 week decline. Again, at the time when everybody has, most people have come back to campus. And then let's see, back up here, 45. So with the clinical employees, again, continuing that downward trend. Pretty low use of isolation and quarantine housing. 6.6% or 5 out of 75 rooms at UAB. And then for vaccine data, still running a little bit over 72% fully vaccinated for all employees and 64% for students, which is, again, pretty remarkable given that it's not being mandated for students. 3 or 4 things that Suzanne wanted to highlight. The first one, these are weekly case counts or weekly total cases per 100,000. So we're declining in all of the ADPH districts. These are by district. So that's, again, getting back to the point that Russell and I were making, it's pretty much declining across the state, with perhaps a couple of rural counties, which don't account to many individual numbers, relatively speaking. Hospitalizations, the solid line is the actual, the dashed line is the estimated hospitalizations. So again, estimating a decline back to what we were seeing before this latest surge that might extend through early November. This is what I was referring to earlier. The weekly cases per 100,000, 248 in Jefferson County, 334 in Alabama. Hospitalizations decreasing, as we've said, cases decreasing. Deaths continue to increase as they typically lag case peak by. That should be 3 to 4 weeks. As I mentioned, CDC now defines high transmission as over 100 per 100,000. Again, we are at 248 here in Jeff and 334 across the state. CDC is suggesting that when cases, weekly cases dip below 100 per 100,000, that changes to policies, masking and distancing could be considered. And that's the sort of trigger point that UAB Health and Safety Subcommittee is focusing on as well. The projections are that cases will be below that trigger point by mid-November. So this was on the one of, I guess, the e-reporter today, the link to information about boosters. If you look at the recommendations, 65 and over, 50 to 64 with underlying medical conditions, and then other groups who may receive booster doses, 18 to 49, based on individual benefits and risk, with underlying risk. And then the 18 to 64, because of occupational or institutional setting, may receive a booster based on the individual benefits and risk. And then they go on to describe UAB medicine employees because of their occupational exposure. And then teachers and daycare staff, et cetera, could also be eligible. I think the bottom line here, boosters are now available, not requiring appointments. Walk in at the Spain Auditorium. Looks like the gates have been flung open for boosters, and this is for Pfizer only, and for those who received only Pfizer for the first 2 shots. Again, no appointment necessary for a booster.